guidance. Now, away from that, the Ministry of Health and the Kenya Medical Practitioners and Dentist Union leaders failed to unlock an impasse that would have ended the nationwide doctors' strike. The ministry has committed to deploying interns to hospitals next month as one of the doctors' demands. But the doctors' union says they failed to agree on their demands and have now asked doctors at the Kenyatta and Moi teaching and referral hospitals to join the strike that has paralyzed services in many hospitals across the country. Brenda Wanga reports on the failed talks as the strike now enters day 5.
The meeting between the Ministry of Health officials, led by the CS for Health and the leadership of the Doctors' Union, did not last long. And when it ended, each side of the divide had its own version of the outcome of that brief meeting.
On the strike, and the judge did direct that the strike be suspended. So as a ministry, we abide by the court orders. And based on the information that we have given to the unions, I think that is the same position, but they have said they need to speak to their members. So we allow them to speak and let us know.
Confirm that the strike is on, and it will get a little bit tedious repeating the same thing because we are in this for a very long time. We intend this to be the last strike of a decade.
The doctors went on strike last week demanding the implementation of the CBA agreement of 2017 that was meant to improve the welfare of doctors, including salary increments for doctors, as well as guaranteed postings of interns to hospitals. The ministry says these issues are on course to being addressed.
We have also briefed the union and agreed that we have now received a confirmation from Treasury, and beginning 1st of April, which is in 2 weeks' time, we are going to begin posting of all the interns.
The union, however, says they will only believe the Ministry of Health when they see the interns working in health facilities.
That we've had a promise before that the interns were to be posted in February. We also had a promise that they'll be posted then in March. Today, we've been given a promise that they'll be posted in April. I must say that goodwill is earned, and it is earned from the outcome of previous commitments. We've had commitments before with government, both in the national and on county governments in the month of January 2023. But nothing to date has been implemented. And therefore, as we go on this strike, it's not a strike that we're going to accept promises.
That has been.
The contentious issues of the CBA implementation still remain just that. The ministry insisting that the matter will be referred to what is now being called a whole-of-nation approach that will see all the players outside the health ministry that are needed to address the issues gather together.
Most of the issues that had been raised by the doctors, we have agreed together with the union that we take them there because they are cross-cutting matters. They are matters that are to do with the Ministry of Education, matters that are to do with the Council of Governors, matters that are to do with public service, matters that are to do with SRC, Treasury, Head of Public Service. So we are happy that those matters are going to be taken there.
Solidarity forever.
The first of the whole-of-nation approaches meeting will take place on Tuesday under the guidance of the Ministry of Labour, where the parties involved will be hoping that they will reach an agreement that will see the doctors call off their strike and the doctors' demands met for the resumption of the provision of critical services to the masses.
Solidarity forever.
Brenda Wanga, Citizen TV.